All right, we're back in the science tutorial office, and this time we're trying to learn about the heart. All right, so there's a few key things they like to ask, and I'm going to try to point out as much as possible, but this is just supplement, so don't rely on me 100%. Okay? All right, so maybe a question they like to ask, I'm going to just put this one here, and they'll say, well, is this anterior or posterior of the heart? Like, are you looking at the back side or are you looking at the front side? And you said posterior, of course. You can see that coronary sinus. You can see that transverse line going left to right, and that's a dead giveaway that we're at the back. All right? If I flip it over, I've got some hallmark little things that we can look at, like this diagonal line. All right? That is the descending interventricular artery that's going to feed the left ventricle. Major player, all right, as far as coronary arteries. So that's the first question. And then they like to ask about the serous membranes. That comes back. So if I have, like, if they have anything pointed, like anything pinned right here, and they say, what serous membrane is covering this organ? Well, you would say visceral, because it's covering the organ, visceral pericardium. Pericardium, P-E-R-I, is like peripheral or perimeter, like all the way around. So hopefully that makes sense. Unfortunately, I don't have a specimen with the parietal pericardium, but honestly, listen to me, you can't miss it. It looks like a trash bag. Like, it looks like one of those Walmart, Kroger plastic bags that is around it. So just keep that in mind. That would be the parietal pericardium. Okay? Another thing is, we open it up, and now we're looking at this layer right here, that muscular layer. So when we say muscle, we say myo. Okay, so this is myocardium. And then the most internal thing here is the endocardium. All right, so just a little different. So like visceral pericardium, parietal pericardium, myocardium, endocardium. All right. Now, another thing that they might have you identify, what stick is what, right? So I'm looking at the front. I know because I see my diagonal line, my descending interventricular artery. And then I'm looking at this guy, and he's most on the right. Okay, this stick is mostly on the right. So I know that it is the superior vena cava. Now, these two can be tricky, all right? But what I want you to focus on is this guy is way in the front, and this guy is totally vertical, straight up and down, and kind of in the center. So this is going to be the pulmonary artery, and this is going to be the aorta. All right, so if you run into anything like that, just kind of keep that in mind. Now, if the heart is propped open and it's got multiple pins going into like the right atrium, then I kind of want you to think about that coronary sinus. Okay, coronary sinus, because that's where that blood's going to flow into. If we are right here at the middle, then we might be thinking more of the lines of like the right and left coronary arteries. Now we're thinking coronary arteries. The first thing that's going to happen is the heart's going to feed oxygenated blood to itself. So right and left coronary arteries. Okay, so if by some chance they've got something just all kinds of marked in the middle, then we're thinking coronary artery. If it's in the right atrium, we're thinking coronary sinus. Okay? Now, just a quick reminder, you have atrium on top, okay, so right and left atrium, and then these V-shaped guys, those are the ventricles, right and left ventricle. You got some heartstrings here, that's chordae tentae, and then you have the papillary muscle. Papillary literally translates into nipple, and so you see that they look like nipples. Kind of deformed, but still. All right, then a little bit of the flow of the blood. I just want to quickly remind you, remember that we are going to start with our veins with deoxygenated blood coming back to the heart so that it can get oxygenated. We have the superior and inferior vena cava. One more thing, coronary sinus. Blood's going to come into the right atrium. As far as these valves, remember that we ride a tricycle before we ride a bicycle, right? So this is our tricupsid into our right ventricle. Notice a little something here. That myocardium is much thinner compared to this myocardium. We can even see that here. Look how narrow that is compared to that. This guy, the right ventricle, only has to push the blood to the lungs, whereas this guy, the left ventricle, very, very important, has to push blood from head to toe. So it's gonna need a little bit more oomph. This right here is the septum, by the way. All right. So anyways, right ventricle, we're gonna contract, and we're going to push the blood through the pulmonary semilunar valve. All right. That's gonna go through the pulmonary artery. Notice that the pulmonary artery is blue. We have kind of made this connection, artery, oxygenated blood. But at this point, this is one of those opposite kind of things. It is an artery, but it's deoxygenated. It's going to go to the lungs, the neighbors. It's going to bifurcate and go to the lungs, pick up our oxygen, do our simple diffusion between oxygen and carbon dioxide. And then we have 1, 2, 3, 4 pulmonary veins. All right, 2 from each lung coming into the left atrium. Notice that these are fully oxygenated. All right, this is where it's a vein, but it's oxygenated. Comes into the left atrium through the bicuspid. The bicuspid is also known as the mitral, down to the left ventricle, contract. Now we are going to go through the aortic semilunar valve. All right, and like we were saying, the heart's really smart. It says, hey, give me oxygen first. So those are the right and left coronary arteries, ascending aorta, aortic arch, and then comes the descending aorta through the diaphragm, abdominal aorta. A little quick reminder is that you're going to have the brachiocephalic. That's going to basically like bifurcate, I guess that's the best word, into the right subclavian and the right common carotid. This is the left common carotid, and then this is the left subclavian. All right, just in case, just a little thing to know. All right. As far as the conduction pathway of the heart, remember that you are going to have the SA node. This is the pacemaker, to the AV, to the bundle of His. Yeah, I was starting to mess up. Bundle of His, and then the Purkinje fibers. Really cool thing. It's like 1, 2, down, back up the circuit, and then it just starts all over. All right, so that's your electrical pathway. So the heart is only going to have 1 or 2 problems. It's either going to have a plumbing problem with all the blood volume, or it's going to have an electrical problem. So I hope this helps you as you study. It's not everything, but it's a good start. Good luck.